The challenge medically is to look at this disaster as having three phases. The first, humanitarian aid. We need medicines and medical supplies to keep those people alive without suffering. Second phase has to do with bringing back up the clinics and hospitals that were devastated. And the third phase is training the physicians for illnesses and trauma that they'd never seen before. We're involved with a historic public-private partnership. The Navy has committed the USS Mercy, a 1,000-bed hospital ship, to meet the needs of the people of South Asia. The ship will be a platform, so to speak, for American physicians and nurses from these United States who have been called to help and are coming forth and to put a face on America's humanity. Well, it was just 35 years ago that there was a wave of volunteers that joined the SS Hope, the converted Navy ship donated by President Eisenhower to Project Hope, and became volunteers to the world. And if you visit with them today, you interview them today, they will say that was the most meaningful experience in their lives. And we're repeating history today. And today we have partners here in the U.S. and partners in Indonesia. Our partners in Indonesia, the Ministry of Social Welfare, and the Indonesia Doctors Association, 58,000 physicians strong. Back here in the U.S., all kinds of partners. Just last week, FedEx stepped forward. And at Dulles Airport, there were 3 flights headed through Jakarta, filled with Project Hope medicines and medical supplies. And those medicines and those medical supplies were in turn donated by the nation's pharmaceutical companies, their medical supply companies. So what we see is partnerships in action, just as President Bush would wish. What we are seeing are an outpouring of support in the way of volunteers. Indeed, it's a profound response to this huge disaster. From Project Hope's perspective, this is a short-term sprint. At the same time, it's a long-distance marathon. And Project Hope plans to be there for the long haul. Today's needs are medicines. Tomorrow's are equipment and training.
My colleagues in the region, what they are doing now is first assessment of the problems that are occurring there. Secondly, coordination of the actions that are needed now. So together with the Ministry of Health, they are making plans and they are negotiating how to develop the actions there. Third, they are developing training of local people, health services staff, teachers in the schools, all key people in the community can be trained, and programs of training are now being developed already. In the first phase, what you see is fear, anxiety, confusions. Some people can stay with some emotional numbness. People can have problems in sleep, eating disorders. The children can have behavioral change in regression. They start with behaviors that they had not since a long time ago. They have, of course, nightmares. People need to be integrated in their natural network. So even if shelters are necessary, shelters should be organized in a way that, for instance, children will find as soon as possible families, or at least people they know, or at least people with they feel familiar. Also, it's necessary in those shelters to organize for the children recreational activities and to organize for the adults the possibilities of their participation in. It's very important for the people in the Tsunami region to have the possibility to bury their relatives and using the ceremonies that are relevant in their culture. They need to have the possibility to grieve, to say goodbye to their beloved ones. The capacity of recovery of human beings is really amazing, and we can see that even in such terrible situations like this one, most of the people, they will recover.